This next lesson will focus on learning disabilities. Please be sure to also review Chapter C2 in our textbook that provides detailed information related to autism spectrum disorder. And the verse guiding this lesson is from Proverbs chapter 1, verse 2 to 4. For gaining wisdom and instruction, for understanding words of insight, for receiving instruction in prudent behavior, doing what is right and just and fair, for giving prudence to those who are simple, knowledge and discretion to the young. Problems with academic function can be a hallmark sign for a number of pediatric mental health disorders. A child struggling in school causes concern, and difficulties with school tasks can leave children frustrated and parents and teachers wondering what's going on. School underachievement is one of the most common reasons for referral to a child guidance clinic. Underachievement, however, may be a symptom of a cognitive or learning disability. Learning difficulties are a dimensional construct, and children with difficulties fall along a continuum, some having less difficulty and others more. It's important to identify whether the academic underachievement is related to another mental health concern or problems in the home or family, or is it attributed to a learning disability? Specific learning disorders listed in the DSM-5 include reading disorder or dyslexia, as well as math disorder or dyscalculia, and disorders of written expression. Key criteria for a specific learning disorder. There are 4 criterion that must be met. Criterion A is difficulty in mastering reading, writing, math, arithmetic, and the difficulty has to persist for at least 6 months and fail to improve after intervention. Criteria B includes difficulty that causes the academic skill to be below the grade level or what's expected for the individual's chronological age and is usually identified through standardized achievement tests. Criteria C includes that the difficulty began in early years of education, even though it may not be identified until later higher education challenges. And criterion D is that it is not something that's caused by an intellectual disability, a neurological, visual, or auditory impairment, psychosocial adversity, poor instruction, or other factors. There is a cultural context to reading disabilities, as some children learn to read in their home language or in a neighborhood language or a language imposed by the academic setting. Children can learn to read in 2 or 3 languages and then may initially have a marked delay. It's evident by the graph here that there is a difference in reading ability that is modulated by conditions of socioeconomic status. One of the criterion for identifying a learning disability is that the child does not respond to intervention, meaning with additional tutoring or one-to-one help, there is little improvement. One concern about the response to intervention approach, though, is that it can be expensive. And Also, the interventions offered can vary significantly. Literacy learning is dependent on the writing system that the child is taught. Here is a map showing various scripts where children are learning to be literate across the world. Modern day writing lays out symbols, often from left to right, such as in English or German, as well as right to left, such as in Arabic or Hebrew, and others still are top down, such as some forms of Chinese or Japanese. Symbol units in English, French, Italian are called letters, while Bengali, Hindu, and Tamil syndromes are called ashara, and Chinese symbols, characters. In dyslexia, the clinical picture is characterized by compromised decoding skills, while comprehension skills are still intact. There is, however, a second group of struggling readers who can have poor comprehensive. Their decoding skills are appropriate for age, but they lag behind in comprehension skills. It has been known for many years that dyslexia runs in families, and a recent study has suggested that there is about a 40% risk of dyslexia in first degree relatives. As a group, poor comprehenders have been much less studied than children with dyslexia. Interventions for treating dyslexia or other reading disorders must start with a sound understanding of the cause and type of reading disorder. It's important to identify the cause for poor academic performance. It can be related to problems in the social or environmental factor. So it can be related to abuse, neglect, or other negative family dynamics. It can also be related to a specific psychiatric disorder, such as attention deficit disorder, a depression or anxiety disorder. But it could also be a specific learning disability. The only way to identify that includes a complete psychiatric evaluation as well as psychoeducational testing. You usually will need to refer a child who's having poor academic function to a psychologist for specific psychoeducational testing. Sometimes the school district provides this service to all children or families, so there is often a wait list and often should be accompanied by a specific request or recommendation by a healthcare provider. In conclusion, don't hesitate to refer your pediatric patient for psychoeducational testing, either through the school district or through a private psychologist, whenever difficulties in learning continue. Recommend a 504 or IEP, individualized education plan, whenever learning disabilities are identified. And it's important to help families to navigate the educational system, especially those who are more vulnerable. It's important to provide targeted interventions and assist families with the access to tutoring or other areas to strengthen their academic performance. Screening tools are critical, and prioritizing high risk or vulnerable populations in the community.